Hello, bhai. Hello to everyone. Sorry for the 2 minute delay. The PDF we just now created and posted. So sorry for the delay. Chalo. So please check it. I have shared it. Yeah, it is there. So kindly check. And we are ready to start our session. How are you all? I hope you all are doing good. And we are having another session for you live. Chalo. Okay. So let's start. Let's continue. How are you all? What are you doing? Chalo. Again, as we are doing our system, it will be around 1.5 hours, okay, and we'll cover anesthesia in such a way that you will never ever forget. Okay, there is a drug called as atracurium. Atra karti hai khatra. Atra, and atra goes to brain and gets stuck. Atra अटक गई, अटैक करती है ब्रेन को, एंड क्या करती है वहां पे लॉर्डानोसिन बनाती है. सो लॉर्डानोसिन दिमाग का लसन कर देता है. सो रिमेंबर, very important is, yes, anesthesia, atracurium, laudanocin, we'll be discussing them all. So please come, let's study, and we are going to rock in today's session. So should I be starting or wait for 1 or 2 minutes for other waiting participants to also join in? So I hope they all will join in soon. Let me just give you a sample of the anesthesia file. So this is our anesthesia file, starting with our beloved TG Morten or Mortin. So please come join. We are starting the session. Please join in. Please join in. Please join in. Please join in. Chalo. Let's start. I think everyone is online now. So let's rock in our session, and we are going to learn about our, yes. Chalo. So see, again, point is every subject will be done. Okay, it will give you 3 to 4 marks. Okay, clear? Thank you, Kushbu, for this. And if you are attending all the session, you are surely going to rock. Okay, that's my personal experience. So many people have passed attending our session, chanting, revision, PYQ, mock test. From 10th of December we are starting our mock test. Don't ever miss it and be there in the, yes, session. That's very, very, very important. Okay, clear? So every subject will be done. I just want your cooperation. If you attend all the classes, be there in all the session, it will be great. If you miss classes, obviously if you start missing classes, you are missing topic. Every topic is important. I'm telling you, requesting you, don't miss any topic, don't ignore anything, because questions can come from each and every topic. Okay, clear? MCQs will be discussed later on. We are right now doing the, yes, chanting and revisions. Later we'll start with faculties discussing the question. I will discuss my medicine, physio question. Other faculties will also be coming. So that will be all on the YouTube. Just be with us, and remember, anesthesia will give you how many marks? 3 marks at least. So let's revise. 3 marks. So how many marks we are going to get? 3 marks you will get, and 3 marks and how many days are left for the exam? 50 days, around 50 days, or yes, 45 days. Let's say 45 days. So 45 days, and let's say it's 4 marks. So you will get 180 out of 300 pass. So just by attending these sessions, you are going to do very well. and you're going to pass. So 45 into 4, 180 you will pass. Clear? So 200 नहीं आएगा पर pass हो जाएगा. And the PDF we are making, they are extremely good PDF. They are going to, yes, cover almost each and every topic. Thank you Vishal. Thank you Vishal. See, we are having all the past students also coming and blessing us and our students who are watching it. So that's why learn from them. Don't miss the session. Be there on the sessions and it will surely benefit you hundreds of times because they are all very important for our learning. Okay, so good evening to everyone and let's start. Okay, let's start. Okay, yes, PG seat, FMG exam, whatever you want, it will be there. Okay, and out of 200, 150 in NEET PG. So that is my blessings to everyone who's watching for NEET PG or for the, yes, okay. Thank you Shashank also for this. Okay, who Dr. alternate account, yeah. For NEET PG at least 2 questions will be there. Okay, understand, NEET PG and this not much difference. Okay, you open any textbook, any prep, marrow, any notes, any faculty, the content is same. Okay, like an endotracheal tube will remain endotracheal tube, is not going to change its name. Okay, same way if they're asking question about the soda lime will remain soda lime, the color will remain the same. So that's why I'm telling you, content remain the same. What changes is the type of question. Okay, sometimes questions might be very difficult, very easy, but nowadays even FMG exam, the questions are almost same level. Okay, very tricky, very indirect kind of questions. So that's why I request you to please study. Yeah, very important. Okay, so NEET PG, yes, you will surely get at least, yes, 150 MCQs from our race sessions. And in case FMG students, I'm telling you 200 plus you can get out of 200 out of 300 in FMG exam. But you need to master the race sessions. You should have complete command over the race. It's not about just mugging, it's about understanding of the concept from the race sessions. Chalo. So time is 1.5 hours. So let's start. Okay, without any delay, because time is precious. We don't have time, it's already 10 minutes. So I'll be starting the session without any delay and we are going to rock. Chalo. So let's continue, let's start, let's do it. Okay, chalo, everyone is online, everyone is bored, so let's continue. Chalo. Medicine will do soon, don't worry. Okay, medicine will do soon. I'm telling you, just be with me, we'll finish all the subject. Okay, so first is World Anesthesia Day is celebrated on 16th of October. Because in 16 October 1846, William T.G. Morton demonstrated ether as an anesthetic agent. So remember Morton and Mortine. Mortine make mosquito unconscious. So what make mosquito lose consciousness? Mortine. And who made the human lose consciousness? Morton. So Morton great hai. Morton great hai. And how to remember the day? 2 October is a very famous day. Why it is very famous day? Tell me. Why 2 October is very famous? Okay. रिमेंबर गोवा गया था कौन, वो अपना 2 अक्टूबर को वो गोवा गए थे पणजी से, याद है ना वो दृश्यम. ओके, प्लस गांधी जी पैदा हुए थे और गांधी जी ने 14 नवंबर को कौन पैदा हुए थे? इस गांधी जी 14 नवंबर को पैदा हुए थे चाचा नेहरू. ओके, सो इट इज नेहरू एंड गांधी एंड यू ऑल नो नेहरू गांधी आर वेरी इंपॉर्टेंट. इन्होंने अंग्रेजों को भगा दिया. सो दैट्स व्हाई वी गॉट फ्री फ्रॉम दिस. सो 14 इज द निमोनिक. सो गांधी जी ने 14 नवंबर नेहरू जी कंबाइन अंग्रेजों को बेहोश करके भगा दिया. ओके, सो दे मेक द फॉरेनर्स अनकॉन्शियस एंड रन अवे लाइक मॉस्किटो आर रन अवे बाय मॉर्टिन. ओके, सो गांधी नेहरू. ओके, या एंड लाल बहादुर शास्त्री also, लाल बहादुर शास्त्री. ओके, नाउ there are two kind of anesthesia, one which goes to brain. If it cross blood brain barrier, obviously shut down the brain and you lose consciousness. Okay, that is GA मतलब गया loss of. And if there is no loss of consciousness, person is conscious but he is not able to feel the pain, then you do surgery is called as regional or local. Like example, for dental surgery, do you need to make a person unconscious? No. Like I went for dentist, what do? They just give a injection in the inferior alveolar nerve and make it, yes, lose sensation. That's the case. Now, local anesthesia is basically from some specific area, not all the body, okay? And the mechanism is they block fast voltage gated sodium channel, and they are mostly amides and esters. So what are the local anesthetics? Amide and esters. Now remember the mnemonic, amide contain two I's. So amide has two I's. Lidocaine, prilocaine, articaine, bupivacaine, and esters have one I. Only one I. Easy mnemonic. So if you get single I, benzocaine, cocaine, procaine, it is ester. So ester is E, one E, and amide, two. So amide is two, amide is two, amide is two, amide is two. Very good. Now, the most commonly used agent is which one? Is our lidocaine or lignocaine. Lidocaine, it is always used with a vasoconstrictor like adrenaline, because that will reduce the blood flow and increase the duration of action. So what it does? Increase duration of action, because they are very short acting. So how do you increase the duration of action? So we increase the duration by injecting it with adrenaline. It is excreted by kidney, very safe agent. In fact, it is the most commonly used. So the most common LA use, lignocaine, lidocaine, also used in cardiac arrhythmias. Okay, long acting bupivacaine is slightly longer than bupivacaine, but it's very cardiotoxic. So yeah, but we can use them for longer effect. Now, if you are giving a spinal or epidural anesthesia, we have to puncture structure. So mnemonic is the same as lumbar puncture. क्या है? Sa 3 liga dab. Sasa liga dab. Sasa liga dab. What is sasa? Skin and subcutaneous tissue. Sasa. What is liga? Liga is ligament. 3 ligaments. 3 ligaments. So how many ligaments are there? 3 ligaments are there. 3 ligaments. Okay. So what they are? Mnemonic is supari andar. Supari. Supra. Supari in and flavor out. So mnemonic is supari in, flavor out. Supari in, flavor. So supraspinous, interspinous, flavum. So what are the 3 ligaments? Supra, inter, flavum. Supra, inter, flavum. The moment you cross the flavum, you enter meninges. How many meninges are there? Dura mater, arachnoid mater, pia mater. So that's why 3 meninges are dura, arachnoid, and pia mater. Okay. So where do you inject the epidural? So epidural is after ligamentum flavum. So what do you inject after the ligamentum flavum? It is our, yes. So this mnemonic is for remembering. So it is your in the, yes, epidural space, that is outside the dura mater. Okay, outside the dura mater. And if you want to put in the CSF, so remember CSF is in subarachnoid space. So we have to inject into the subarachnoid space. So remember, if you are going subarachnoid, that is after the arachnoid, you are going to do spinal. If you are injecting it here after flavum, so after flavum is epidural. So after flavum, where is your needle? Is epidural. Please remember, they are all exam question. Is epidural anesthesia. So epidural. Now obviously it need more dose. More dose. Why? Because you are not giving in the CSF, you are giving outside. So need more dose and less potent. And these both, spinal and this, they are used in the surgeries of lower body. Like example, leg fracture or some delivery, cesarean, etc. We can do hernia surgery. We can do the, yes, spinal or epidural. Now, remember in which case CSF will be lost. Tell me which case CSF will be lost. Anyone? Tell me. Which case CSF would be lost? Anyone? CSF. Obviously in the spinal. So that's why there is a loss of the CSF. So this CSF leak can cause low BP and headache. MCQ. So hypotension, headache is a finding of what? Spinal anesthesia, but is more potent than epidural and need less dose. Why it need less dose? Obviously because you're giving directly in the CSF, so it affects the nerve roots much more easily, and that's why need lower dose. Side effect, I told you, hypotension and headache is more. Now it is used in, again I told you, lower body part surgery, like below, you can say thoracic or lumbar vertebra, like all the surgeries in feet. Let's say someone is having fracture of the medial malleolus in the leg or some leg surgery. So you can do them in your, yes, spinal epidural anesthesia. Prostate surgery, again you do in spinal. Delivery, cesarean you can do, or any uterus or vaginal surgery, limb surgery we can do. We cannot use them in aortic, cardiac, heart or organ transplant. They are done in GA. We need GA for that. GA. Now, epidural is below umbilical surgeries we use just like that, and site is thoracic or lumbar vertebra we give. Okay, spinal is given mainly L4, L5 area. Mainly L4, L5 is the site. Okay, now it is indication are same, and we can use Tuhi needle. Tuhi. So what we use? Tuhi needles. Okay, not Tohu. Tuhi needle. Tuhi needle. Okay. Yeah, I will always upload this. Clear? I told you we inject the needle and insert the agent in the what space? Subarachnoid space for the spinal anesthesia. Okay, spinal anesthesia. Okay. Now, next question. It causes less hypotension and shock, so that is why it is safer, but need more dose. Okay. Now come GA. GA is what? General anesthesia. The agent we give, they cross blood-brain barrier. They're highly lipid soluble. They go to brain and shut down the brain. As they shut down the brain, you lose your consciousness. So what causes the loss of consciousness? It's general, and they can be done for any surgery. Not just this, but any surgery we can use GA because the person is unconscious. Okay, only problem, the person has to be maintained by you, so you have to maintain his pulse, respiration, BP, respiration, all. That's the problem. Now example, obviously laparoscopic surgery, neurosurgery, kidney, organ transplant. Now remember, all GA act by GABA. All GA GABA क्या? बंद, ब्रेन को बंद करते हैं GABA, and except is ketamine और xenon. So remember, mnemonic X काट गई. So किसने काट दिया? X ने काट दिया. ठीक है, ग्लूट और गई. So X cut. So xenon is X, keta is cut. So these two act through NMDA, glutamate antagonism. Rest all are GABA. Rest all are GABA. Okay, rest all are GABA. Okay. So how are the notes? Guys, give your opinion. How are the notes? Are you liking them? Okay. Yes. Chalo. Let me now revise and ask you question. Question for you people. Okay. What are the structure pairs? Tell me the structure pairs in lumbar puncture and this. So what are the structure pairs? Tell me the mnemonic. Mnemonic. Bolo. Mnemonic. We are full of concept with fun, and we are not just mugging. We are understanding and then remembering. That is what race is. Revision. क्या बात है? सा 3 बार लिगा और फिर डैप. So सा लिगा डैप, सा लिगा. Okay, can you tell me the ligas? Can you people tell me the ligas? Yes. Yeah, obviously there is different needles used. In fact, we sometimes have to use even the broader ones. Okay, clear? Yeah. Chalo. Liga. Yes. So our admins are back, Dr. Jitendra, and also thank Dr. Vishnu. She worked day and night for this PDF. I don't know how she managed to did it in just one day. Arrange everything, plus GT is there. So I'm telling you, okay, it's great. Okay, supari andar, inter, and then phlegm. Very, very important. It has been asked multiple times in the exam, so be very careful. INI-CT 2021, it was there. So structure pairs, the last to be pairs in epidural, phlegm. Then epi start. Very good. Very good. Okay, chalo. Now let's come to that. What are the components of GA? So first is loss of consciousness. The person become unconscious. Then there is loss of reflex. That is, the person is no longer able to react. Otherwise, you do some incision, pain, person slap you, because even unconscious person can do reflex or he cough out and the tube might come out. So that's why you want reflexes to be gone. Then no memory. Why? If the patient has memory, he might learn the surgery. So patient learn the surgery and start doing. Because Indian patient, what they want कि they learn all the treatment. कई बार पूछते डॉक्टर ये रेड टेबलेट किसका है, डॉक्टर ये किस काम आता है, and once they remember डोलो, like example डोलो. Once Indian patient learn डोलो is for fever and pain. भाई साहब डोलो की उन्होंने माँ बहने कर दी. कुछ भी हो जाए डोलो, कोई मर गया डोलो, किसी का कुछ हो गया वो डोलो. ठीक है, तो डोलो ले लेके इन्होंने अपनी क्या खराब कर दी, लिवर और किडनी डैमेज. डोलो. Okay, then muscle should be relaxed so that you are able to easily operate on the patient. And analgesia. Analgesia means no pain. If the patient has pain, how will you do the surgery? So that is the case. Okay, now steps is, first we give oxygen. Why? Because as you give anesthesia, patient might suffer from hypoxia. So first we give 3 to 5 minutes pre-anesthesia, 100% oxygen. Then the 3 steps are induction. It's not indication, it's induction. Okay, sorry, induction. Make it you. That's why I told you, sometime errors will be there. Induction, okay. So what is induction? It is starting the agent. So induction is starting the agent. So we will start the agent. What is this starting of the agent called as? It is given the name induction. Then we will use either which agent. For induction, we are capable of using what agent? We can either use our agent which is IV, or we can use our agent which is, yes, intravenous or inhalational. It's gases. They become gases. So what are the agent becoming gas called as? Inhalational agent. So they are called as inhalation. Very soon the book will come. Okay, very soon the book will come. But again, we are working hard to create. It's not like some kind of easy thing that we can create. It takes effort to go through all the notes, all the content, all the material, select the. It take us almost 30-40 hours for a single subject. 30-40 hours. And this effort will only be fruitful if we get support from you. I told you that time also, if you people attend the classes and share this links. I see other faculties are getting 1,000+ viewers. Our viewers are hardly 400, 500. So that's why I want as many as possible. Then only the results will come. Otherwise, all my hard work will be down the drain when no one say, "Arey, it was good." Just few people. वो तो वही बात है ना. If there is very few people attending, very few will get the benefit. Very few will get good score, good marks, good rank, pass the exam. So I want more to come so that we get benefited. Okay, चलो. Then we continue the agent. So मतलब पहले क्या किया? पहले डाला, फिर डालते रहे. डाला agent और डालते रहे. फिर पलटा दिया, घुमा दिया. तो पहले डालो, डालते रहो और फिर रिवर्स कर दो. रिवर्सल. In reversal, when you stop the agent, the person regain consciousness. So what occurs? Regain consciousness. So person will become conscious. So regain consciousness is the case. Okay, so it is regain the consciousness. Regain the consciousness. Okay. Now sometime we can use flumazenil, which is our antidote for GABA drugs. GABA. So that's why it can be used in most of the agent because they act through GABA mechanism. Now there's something called as TIVA. TIVA is total IV anesthesia, and that is mainly propofol, which we'll discuss very soon. So propofol is an example of TIVA. So propofol is the example of TIVA. Now to prevent a wrong connection of the cylinder with the circuit, we have something called as safety method called as pin index. It will prevent the connection of wrong cylinder with your circuit. Otherwise, a person need oxygen and you give carbon dioxide. Ram Nam Satya. So that is why you want right identification. So that is pin index. And I really wish there's a pin index in people relationship also. What do you say? It is my personal opinion. Relationship should have a pin index. Okay, that only the person with engage, they should have the right pin and nobody else. Nowadays, there's no such system. Like a Netflix password, your pin is shared with everyone. Plus, they are also doing swapping. तो मेरा वो ले लियो Hotstar, मैं तेरे को Netflix दे दूंगा, Amazon दे दूंगा. क्या चल रहा है भाई? Pin index means अपना index, अपना circuit, अपना cylinder. Okay, चलो. Now I'll make it easy for you. I'll use a paper to write. This is what is written, but I'll use. Okay, so understand. Write like me. 5, 6, 7. Now 7th day in the week. 7th day is Sunday, and Sunday is the day for entertainment. Entertainment. Remember Sony Entertainment TV Suryavansham. So entertainment. So that is Antonox. So Antonox is 7. Remember Antonox is 7, and it contains 50% N2O, nitrous oxide, and 50% oxygen. That is why its name is Antonox. What the Antonox full form is? It is Antonox. It is N2O and ox is oxygen. So it is Antonox. Okay, so it is yes. Okay, chalo. Chalo. Thank you very much. Thank you very much. Chalo. So this is called as Antonox. So what is it called as? It is called as the Antonox. Now let's start with 6. So 6, remember like this 6. So 3 C's. 3 6. 3 छक्के याद कर लो. 3 छक्के. तो 1 छक्का, 2 छक्का. 1 6 2 6. They are carbon dioxide. And carbon dioxide cause pollution, gray color. So they are gray cylinder. So color is gray cylinder. Okay. And 3 6. 3 छक्के. So remember the mnemonic 3 6s on a cycle. So imagine in your brain 3 6s on a cycle. 3 छक्के साइकिल पे जा रहे हैं. 3 6s. Okay. So 3 6s on a cycle. 3 6s on cycle, cyclopropane. Easy. So 3, 6 is on cycle, cyclo. And Dr. Vishnu is also back. Okay. Thank you, Dr. Vishnu, from all the people who are watching us live, and special thanks to Dr. Jitender for all the hard work. Okay. Without these two people, it will not be possible to even take this session. Okay. They work day and night to create this PDF with perfect thing, small minor changes. Okay. We'll keep on doing, but it is going to be a great, thing, because these people are giving their best to arrange. Okay. So they are working like perfect sync. Like I'm the face, I'm like the actor, but my script, my songs are done by these people. So they are the hero and the heroine behind our race sessions. Okay. So I am the one who's doing the speaking explanation, but the content is created mainly by these two people. So I'm very thankful, and I want everyone to applaud them. Because of them, we are having this successful content presented to you. Okay. So once again, cyclopropane. Now cyclopropane, if you remove the cycle, छीन लो इनकी cycle, 3 छक्कों की cycle छीन लो, तो what is left? Oprane, oprane. So oprane sound like orange. Oprane sound like orange. It is orange color. So remember, it is orange. So if they ever ask you what the color is orange. So cyclopropane is orange. Cyclopropane is orange cylinder. Orange. Okay. Now we come to our 5. How many elements are there as per Indian mythology? Panch Tattva, 5 elements. So there are 5 elements. 1 element, second element, third element. So 1 element, second, third. 1, 2, 3. 1, 2, 3. So 1, 2, 3, 1, 2, 3, and 1, 2, 3. 1, 2, 3. Next subject is, yes, the next subject is your, yes, physiology only. Okay. So 1, 2, 3. Now remember, the first element which keep us alive is air. So first is air. Second, what is there in the air? Oxygen, O2. And third is N2O, nitrous oxide. So how to remember the mnemonic? 1, air has 1, I. Oxygen is 2, 2. It's 3. So N2 or 1 oxygen. So become total 3. So how many atoms are there? 3 atoms are there. 3 atoms are there. 3 atoms are there. Now remember, what is the color of sky? Sky is blue. So it is blue. Sky is blue. So nitrous is blue cylinder. Blue cylinder. So first let's revise. Who is gray cylinder? Carbon dioxide. Who is blue? Nitrous oxide. Who is what do you say? Orange? Cyclopropane. Okay, now understand. Second question. Without oxygen, you will die. So oxygen, if it is not there, you die. Without oxygen, die, and you have gangrene. You have gangrene. What is the color of gangrene? Black. So without oxygen, hypoxia occurs, cell die, color is black. So gangrene is black. Gangrene is black. Okay, clear? And if oxygen, you live, you are white. So black and white. So remember, without oxygen, die, black. If oxygen, you live, you are white. So black and white. So that's why it is black body and white shoulder. Never ever forget, it is 100 times asked question. Black body and white shoulder. Black body and white shoulder. Black body and white shoulder. Okay. NLC mock are free. Okay. No one is going to charge you. Just join the app and we'll discuss it after the session. What is that? Okay. So finally, what will be N2O? It will be mixture. It will be blue and white. Blue and white. So what is blue and white? It is N2O. So it is blue and white. N2O is blue and white. N2O is blue and white. Let's come and see. So what is air? 1,5. Oxygen 2,5. Nitrous oxide 3,5. Carbon dioxide more than 7, 1,6. 2,6 is again CO2 less than 7%. 3,6. 3 6s on a cycle. Cyclopropane. Propane sound like orange. See, propane sound like orange. And Antonox is blue and white. Blue and white. Blue and white. So it is blue and white. Antonox is blue and white. Let's see. Who is this black and white? It is our oxygen. Black and white is oxygen. What is blue? N2O, nitrous oxide. What is this orange? Cyclopropane. So this is orange, cyclopropane. Carbon dioxide, gray. What is blue? N2O. What is black and white? This. Okay. Now you don't have to remember this ethylene and this helium. Helium is brown. Brown is helium. So helium is brown. So helium is brown. So it is brown. Helium is brown. Heliox is 2 and 4. That is brown and white. This is heliox. Heliox. So this is heliox. Okay. This is air. Air is basically gray body with black and white shoulder. Let me write the remaining ones. So it is blue body with white shoulder. It is gray. It is orange. It is blue. It is black body, white shoulder, and air is gray body with black and white quarters. Black and white shoulder. This cover all our important system. Ethylene is 1, 3. Okay. So are you clear? See, 1, 2, 3 is basically connection, the primary and the secondary connection. Are you clear? So 1, 2, 3 is the size and 5, 6 is about the elements. Are you clear? Like air, oxygen, CO2. Understood? So that is the case. Okay. Chalo. So let me ask you a question. Should I ask you a question? Are you ready? Chalo. I'll make a cylinder. You tell me what is it. Should I make it? Okay. Tell me what is this cylinder. What is this cylinder and its pin index? What is this cylinder? 400 alive. Thank you very much for coming. Yeah. Batao bhai. Order account. Now you'll not forget. What is this? Gray na. So gray is what? Gray, gray, gray. Gray, gray, gray. Gray is our CO2. Gray is CO2. Very good. So gray is CO2. What is the pin index? 16 and 26. It is 7%. It is less than 7%. Done. Okay. What is this cylinder I'm making? What is this cylinder? Anyone? What is this one? I'll show Antonox. Okay, don't worry. Okay. So what is the case? Tell me. Oxygen. Very good. What is the pin index? Pin index. Very good. 27. So 25, total 7. 25. Okay. Tell me what is this one? What is this one? What is this one? Anyone? This is. Yeah, I'm keeping. I'm not deleting. Okay, it's there. I've not deleted. Chalo. Yes. It is Antonox. No. It's Antonox. Because there is blue and white. Antonox. And it is 7. That's what I'm telling you, na? Tricky things. This one. What is this one? This one. Yes. Sunday's entertainment. This is our N2O. Full blue. So that's the misconception people have. If white shoulder and blue is Antonox, if full blue, N2O. Full blue, N2O. Full blue, N2O. Okay. चलो एक और कर देते हैं, देखते हैं कौन बताएगा. ये anyone who can tell me what is this? Anyone? Very good. Helium. क्या बात है? Very good. Last for you on your screens. Tell me this one. बता दो. क्या है? What is this on my head? Favorite color nowadays in Indian elections. Indian election में हर तरफ भगवा रंग छाया हुआ है. Clear? छत्तीसगढ़, MP, राजस्थान तीनों में बीजेपी जीत गई है. तो what is the color? Yes, it is cyclopropane. What is the color? Orange. Pin index. Pin. Tell the pin. क्या बात है? Misty is the first to give the answer. It is 3-6. It is 3-6. Congratulations, you are on track. Chalo, let's come. Now we'll discuss inhalational agent. Now they have two properties. So what are the two properties? BGS and MAC. MAC and BGS. Now what is MAC? Is minimum alveolar concentration. Simple language. It is the concentration at which 50% of patient will have loss of sensation and reflex action. That is, they will not have any reflex movement. 50%. More the potency, lower the MAC. Why? A agent need 5% concentration, other need 20%. Who's more potent? 5%. In 5% it causes anesthesia. So that's why lower the MAC, more. So mukka. MAC is mukka. Mukka maar ke muh tod dunga. So MAC. So if my MAC mukka is strong, my punch, I am more potent. So MAC is reverse of potency. MAC is the reverse of potency. Okay. Thank you. Thank you. Yes, you are right. 18,000. Chalo. Now, next question is, if they ask you what the most potent, methoxyfluorine yaad kar lo is the most potent and the weakest is N2O. What is the weakest? N2O. सबसे नल्ली gas है nitrous oxide. So it is the weakest. It is nully, cannot do anesthesia. So what gas is the nully gas? Means nikamma, useless, or it is not significant gas? Nitrous oxide. So nitrous oxide is a good analgesic. That's why it is used in dental surgery. Remember? So it was used in dental surgery for, yes, all the RCT, etc. But it is a very poor general anesthetic agent. Why? It doesn't cause loss of consciousness. Why? Because it has MAC of 104, highest MAC. So least potent. That is why it cannot cause GA alone. So that's why it is what? Like Nalla. Remember, people who cannot fulfill their dream, they make other people dream fulfill. मतलब जिनका खुद का सपना पूरा नहीं होता, वो दूसरों का सपना पूरा कराता है. What I say in English, I say in Hindi too, don't mind. And people who cannot get their setting, their relationship, they help other people get setting. Those who cannot book OYO hotel for themselves, they book for other people. Agent बन जाते हैं, दलाल बन जाते हैं. ये है आपकी नल्ली गैस. So it help other agent like halothane, sevoflurane to produce the effect. So that's why it helps the other gas. So that other gas is called as second gas effect. So who's the first gas? First gas is nitrous oxide. First gas is nitrous oxide. Okay, it is helping the other agent, helping the other agent. Now, so when you give this and when they are given, they displace the oxygen. They displace, the word is displace the oxygen. As they displace oxygen, it causes hypoxia, called as diffusional hypoxia or third gas effect or FING. So who's the first gas? First gas, it is nitrous oxide. Second gas, CO, halothane, whatever. And third gas is oxygen, called as third gas or the FING effect. So किसको फेंक दिया? Oxygen को फेंक दिया. So FING is fact. So what you should give? Treatment. Yes, we give 100% oxygen. That's why you monitor PO2 of the patient and immediately give the oxygen to counter the hypoxia. Counter the hypoxia. Now, it also contain oxygen. Okay, Antonox. So that's why we give Antonox. And Antonox problem is it can cause fire. Why? Because oxygen is very potent. Yes, fire, increasing gas. That's why contraindicated laser surgery. So contraindicated in the laser surgery. Okay, okay. Chalo. Now also it causes a increased pressure in air filled cavity. So that's why avoid the nitrous oxide in pneumothorax, intestinal obstruction, middle ear surgery, etc. because it increase the pressure and cause more problem. Now come BGS, blood gas solubility, BGS. Now it is the opposite of speed. So more the BGS, less the speed and vice versa. So remember, higher BGS. So if the gas dissolve in blood, it will not go to brain. So less it dissolve in the blood, more goes to brain. So that's why higher BGS means slow induction and recovery, and lower BGS means highest induction and recovery. So fastest inhalational agent. So what is that? It is the xenon. So xenon is like your ex. In Russian, Zina also means wife. So Zina bhag gayi. So uski Zina. So xenon is fastest. So who's the fastest agent? It is xenon. So xenon is your ex which run away very fast. So once your work, her or his work is done, they run away. So kaun bhag gayi? X bhag gayi. X. So it's a very colorless, odorless and the ideal agent. सबसे बढ़िया जबरदस्त जिंदाबाद xenon. So xenon zindabad, xenon. Xenon is the best, very fast, no side effect, very pleasant recovery and very good analgesia, everything. Only problem, it is expensive. Very, very expensive. So expensive, like your ex was. So your ex was very expensive. Remember, but never insult your ex. Why? Because they gave you experience. So respect your exes. They gave you experience. Okay, clear? Maybe some other things also they gave you. Maybe, okay, but they gave you experience and they spared your life. They might be spoiling someone else's life, but they spared your life. So be grateful to all the exes. I am always, always, always Yes, always, always. Okay, chalo. So clear now. So this is expensive. So what is very expensive? Yes, xenon is very expensive. That is why. And low potency because MAC is 70. MAC is 70. So it is very close to nitrous oxide. Now, halogenated compound. So they release fluoride. Fluoride is a halogen. Remember chloride, halogen. So they are chloride, iodide, brother. And they act through GABA mechanism and inhibit the CNS, and they end with fluorine, except halothane, which is again name itself is halothane. So all the fluorine is what? It is our halogenated compound. So all the fluorines are halogenated compounds. So they are halogenated compounds. Clear? Chalo. So clear now? Okay. Now remember, most potent is methoxyfluorine. So most potent is methoxy, but it causes renal failure. It causes renal failure. Why? Because it can cause highest amount of fluoride release, which can damage the kidney. So how to remember this? A very simple technique. Methoxy cause problem in Mutra tyagam. Mutra means urine. So it cause problem in the kidney. So methoxy, so that's why it is not used. Now, what are the agent used? So we use basically 4 main agents. So we use 4 agents. What they are? Halothane, H. Then we use the, isoflurane. I'll write like here. Isoflurane, then sevoflurane and desflurane. So they are the agents that we use. So what are the agents we use? Halothane, isoflurane, sevo, and this. And what are the mnemonic is? Mnemonic is his dream. His D. Uska D. D for dream or desire or danda. Uska danda. कुछ भी याद कर लो. His dream. So HISD. Okay. अरे बोला ना, it is the most. कहाँ लिखा non expensive? It is very expensive भाई. That's why it is not used. So X is expensive. तो याद कर लो expensive है. So what is the expensive gas? Xenon is expensive. Okay. Done. चलो. Okay. तो his dream, his desire, his जो भी D. Okay. So H is more potent than I more than S, and S more than D. So who's the nullest? It is the desflurane, but stronger than nitrous oxide. Des is weak in these 4, but stronger than this. And who's the most potent? Methoxy, but we don't methoxy. So what are the 4 agent we are using? His, HISD, his. So who's H? Halothane, isoflurane, sevoflurane, and desflurane. Sevo and des, sevo and des, sevo and des. Then minimum VGS. So again, D has the minimum. That's why it is fastest in speed. So speed, it is fastest. Okay. So what is fastest? D is fastest. I and S and H is the slowest. So remember, ulta karna hai. Ulta, opposite. So opposite of the his is dish. So dish in speed. So who is the least potent? D, but the fastest speed. It is slowest but most potent. Most potent. Slowest but most potent. Slowest but most potent is the case. Okay. Chalo. Very, very good. Okay. Chalo. I discussed now second point. Second, non-explosive. अरे भाई बम नहीं फटती. That is no blast, no explosion. No explosion, combustion. समझ में आया? फटती नहीं है. Clear? So it is not going to blast. Not expensive, explosive. Okay, chalo. Done. Okay, now let's start. Halothane is red color. So remember, hello, heart. क्या बोलते हो? हाय मेरा दिल, हाय दिल. So hello, heart को बर्बाद करती है. So hello, heart. Hi, hello, हृदय. हृदय कलर भी क्या है? थोड़ा एम्बर कलर का रखते हैं. एम्बर is slightly yellowish, so it's kept in a amber because sunlight can break it. It can break with even sunlight, and it cause maximum fluoride release, and that's why it's very hepatotoxic. तो क्या करती है? हार्ट और hepatotoxic है, and it also cause bronchodilation. That's why very useful in asthma. So can be used in children with asthma, and it's sweet smelling. So again दोनों चीज अच्छी हैं. Second most preferred in children, most is sevo, because sevo is sweet. Sevo. Okay, so halothane. Then come iso. Iso color is purple. Iso is purple. ISO is purple. ISO is purple. Okay. It is irritable. It cause, yes, it is not good in children asthmatic, but it is mainly used in neurosurgery. So for neurosurgery, ISO is used. So neuro ISO, neuro ISO, neuro ISO. Okay. Yeah. Yes. So ISO is purple. Despacito. So desperate. So it is very, very, very low solubility. So very fast. So it is one of the fastest agent. So it is very fast. So it is very, very fast. So rapid. And it is very highly irritating. Dirty smell. So des is dirty smell cause dyspnea. So remember the mnemonic: rapid, des, and dis. And the color is blue. Color is blue. So it is blue color. So the color of the canister is blue. So desflurane is blue. Desflurane is blue. Okay. And SIVO. SIVO is sweet. And children are sweet. So they are sweet. And that's why the most preferred in children and also daycare anesthesia. Daycare anesthesia. SIVO is share. What is the color of share and the sevia? Save we eat, yellow. So remember what is the color of save, dal save? It is yellow. So SIVO is yellow, SIVO is yellow, SIVO is yellow. Okay. Chalo, thank you very much, Rahul. Yes, for passing the exam, study, and this is. So yes, Desi boys are fast. You can remember Desi is fast. Desi na bolya kar chori, sabse fast hai Desi. Okay. SIVO is sweet. SIVO is sweet, yellow. Okay. Yellow. Okay. Agent of choice in daycare surgery, avoid in renal surgery. Okay. So it is used in asthmatics, cardiac surgery, neuro, liver. In terms of inhalational agent, which agent? IA. So who is the best IA? Sevoflurane. Brain surgery, ISO can be used. Brain surgery, ISO can be used. Okay. Now remember, yes, daycare surgery is basically mnemonic DISMAP. What the mnemonic is? DISMAP. What is this is? This is DES, ISO, and SIVO. So what is DES is? DES is DES, ISO, SIVO. DES, ISO, SIVO. What is MAP is? MAP is midazolam, alfentanil, and propofol. Propofol. Out of these, the best is propofol. So propofol is the best overall agent. And in the gases, SIVO is best IA. And it is overall best. Don't forget this. So who's the best agent? Propofol. So best agent is propofol. Best is propofol. Okay. So let me ask you questions. Will you be ready to answer? Okay. Tell me, who is the fastest gas? Fastest. Rappa rap. Fastest. Who's the fastest? Yes, very good. Yes, Vishnu. Yes, add the extra point. It is in obese. We can prefer DES. Fastest. DES. Is DES. Desi boy. Okay, clear? And what is the least potent? Least potent. Okay, I'll give you option. Option is DES, ISO, Halo, and SIVO. Who's the least? DES. And if they give DES and N2O, who's weakest? DES or N2O? इनमें से least potent कौन है? Least कौन है? Least. If your concepts are clear, tell me. Who's the least out of these two? Who's the least? Out of these two? Yes, N2O is the least. And even above SIVO, who's the fastest? इसका भी बाप, Xenon. X काट गई. X is the fastest. X is the fastest agent. Very, very good. Okay. For children, what will you use? For a child, what is your preferred agent for child? Preferred for child. Child. Preferred. Obviously. Yes. Yellow. Well, it is SIVO. Okay. And what are the color? Color. अरे N2O नहीं यूज करते मुकेश. Yellow. Okay. What is red? Red. What is red? Red. Hello is there. Okay. डे केयर सर्जरी बेस्ट IA, डे केयर IA, डे केयर IA, डे केयर IA, डे केयर IA एजेंट, बता दो, टेल मी डे केयर IA. वेरी गुड, सीवो. एंड इवन बेटर देन सीवो, सीवो का बाप, बेटर देन सीवो, हु इज बेटर? बेस्ट, बेस्ट पूछा, बेस्ट 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 बेस्ट, सीवो के ऊपर प्रोपोफॉल. सो प्रोपो इज सबका बाप. सो हु इज द बाप? देख देख, तेरा बाप आया. प्रोपोफॉल इज द पापा, सबका पापा, सबका बाप, प्रोपोफॉल. So nowadays, if they ask you, boss is propofol. Okay, let me ask you a question. What is 3,6 pin index for? 3,6 is the pin index for which agent, which substance? 3,6, 3,6. अरे I'll do ortho also, भाई. Why worry? ठीक है, this third subject, trust me, I will cover all the 19 subject. Okay, चलो, very good. Cyclopropane. Okay, cyclopropane. Okay. One more question for you people, and that question is 104 is the MAC for which substance? 104 MAC. Again, it's a PYQ. 104 MAC. Very good. Yes, close air filled cavities. Don't use nitrous oxide. क्या बात है? Very good, Dr. Vishnu. All these one-liners will be posted in the Telegram today. Be ready and read them plus MCQs. Very good. It is nitrous oxide. I am very proud of all of you, and I'm very, very, very happy to announce you all are going to do well in both the exam, FMG and NEET PG. And in fact, I want to ask, who is your teacher who's taught you such well that you are able to remember everything and not make a mistake? So who is that best great teacher? So who is the teacher? कौन है आपका वो टीचर? अरे बाबा, विल पोस्ट, डोंट वरी. ओके, थैंक यू थैंक यू थैंक यू थैंक यू. ओके, अच्छा लगता है कभी कभी. sometime you should listen to your own praises, because it make you, because if you people will not give compliment, how will I feel? What am I getting from you people? I'm only getting some nice compliment. So if just single compliment, single post for us and the team NLC you can make, okay, it will motivate us, boost us. Like we get messages from people, it make us so happy. We love you all. For just small gesture, share the link, share and subscribe our Telegram, our YouTube, and also just single comment ki sir thank you, team thank you, Dr. Vishnu, Dr. Jitendra thank you. That's it, nothing else we want. Thank you, love you all from this channel. Very good, we are done almost, more than half. Let's continue. Now we're discussing IV agents. Thiopentone, it's a barbiturate and it was used as basically a induction agent. What the purpose was? Induction, just one word, induction, because it's very very fast, very very fast, around 11 seconds. So what is the induction? 11 seconds it will cause the person to lose consciousness. So that's why it was, smell is garlic. It was used basically neurosurgery, like example EDH, you want to do a Burr-Hall craniotomy, we can give the thiopentone because it causes very fast anesthesia. Burr-Hall craniotomy. Done. I told you, Sivo propo, best is propo, best is propo, best is propo. Okay, best is propo. Okay, thank you very much. Thank you to everyone. Chalo. Now, just remember one word. It's contraindicated in, yes, porphyria. So remember, thiopentone, याद करना, is barbiturate. And Barbie, wear a frock. Barbie. So Barbie frock फाड़ देगी. Barbie फाड़ देगी. Porphyria. So never use in porphyria and heart disease. So in heart disease, don't use barbiturates. Heart disease, we use etomidate. We don't use thiopentone. Then come our champion, papa of all, propofol. Propofol is actually diisopropyl phenol or alcohol. So iso-alcohol. So it's, okay, methyl alcohol. So it's diisopropyl phenol or alcohol. Okay, it's alcohol. Okay. Then It is highly lipid soluble with a rapid onset that costs 30 seconds. Who's faster? Thiopentone is faster, but again, nowadays we use propofol. Then it decreases the incidence of nausea, vomiting. So again, no risk of aspiration. Available as 1% propofol in which oil and water emulsion is there. Milky white. One more word. Milky white, isopropyl alcohol or phenol is there, and it also contains EGS. EGS. What is EGS? Egg, glycerol, and soya bean oil. So what are the substances? Egg, glycerol, soya bean. Egg, glycerol, and soya bean. Okay, yes. What is the thank you kya baat hai? Okay, we are happy that we have people from, yes, Ukraine, also from other places. Thank you. Okay, site of pain is basically our, yes, it is our propofol. Propofol cause the site of the pain, injury and pain. Clear? Yes. Chalo. Now, most common induction agent nowadays is what? Not thiopentone but propofol. Also, it is used in malignant hyperthermia because it has no risk of hyperthermia, open eye surgery, then neurosurgery, hepatic, liver. Why? Because it can be used in the liver and kidney disease patients. So it can be used in liver, kidney disease patients also. Patients, it's E. So what can be used in liver and kidney disease patient? That is the case. Okay. Used for procedural and ICU sedation, etc. So the most common, just remember propofol. Most common also for daycare surgery. Okay. It's not in, but remember daycare surgery. Now, side effect, one is site of injection, pain. क्या बात है? तंजानिया भाई, great. क्या बात है? Love you all from, yes, Gautam Nagar, Jindabad. I'm in Gautam Nagar. Okay, center of Gautam Nagar. Okay. Now, pain at the site, ask in the exam, hallucination, sexual fantasy, because of alcohol. Alcohol all cause sexual fantasy and visual hallucination. Remember Munna bhai, it's alcohol. So alcohol cause sexual desire and also opisthotonus, that is increase muscle tone. Curvature like this, as so back curve like a snake. So increase muscle contraction is opisthotonus. Okay, tonus. U. Chalo. Green color urine. So if you give too much, it can cause green color urine. Now ketamine. Remember, ketamine is cut the mind. Ketamine is cut. So it is an NMDA antagonist. I told you two drugs act on NMDA. One is ketamine. What is the other drug? Tell me. Thank you. Tell me. What is the other drug? Anyone? Which act through NMDA? Other drug. Tell me. Other drug. Kya baat hai? Okay. All those who are in Gautam Nagar, they can meet me anytime. Okay. Yeah. Tell me. And we are also launching offline free sessions for all people in Gautam Nagar. Those who are in Gautam Nagar, they can contact the Institute NLC for free revision and chanting session. Okay. Some of the tests will also be organized for them free if you want. And in Gautam Nagar, you are most welcome to come to NLC and ask what are the program free available for them. So free revision, chanting, test are available. Okay. क्या बात है? मस्जिद मोड बिल्कुल. Okay. Xenon. चलो. Ketamine is a complete anesthetic because it causes all the feature. Analgesia, amnesia, unconsciousness. But main thing is the patient appear to be conscious but doesn't respond to sensory. Means he is awakened but not feeling pain. That means you have cut the mind from the body. So what cut the mind from the body? Ketamine. So it cut the mind from the body. That's why it is. But problem is it is not used in neurosurgery and also cause post-op hallucination. It's a PYQ. So what agent cut the mind and cause hallucination? It is ketamine. Ketamine. Okay. Ketamine. Okay. Yes. Fine. And it increase sympathetic activity and increase all pressure, BP, ICP, IOP. That's why it is not used in hypertensive or glaucoma. So that's why contraindicated in neurosurgery, also hypertension, glaucoma, so that you can yourself solve it. Okay. Now, increase the muscle tone and also reflex are not lost, they are present. That's an interesting thing. So patient retain cuff, corneal, swallowing reflex. Okay. Muscle tone is increased. So that's why it's mainly used in unstable patient with low BP. So if BP is low, other agents are not very effective. Especially IV agents are not. Why? Because if the circulation is slow, how will they reach the brain? So that's why if low BP, we can use ketamine. So ketamine, or there's a myocardial depression in sepsis. Sepsis cause what? cardiogenic shock by suppressing the myocardium, and is mainly also used in reactive airway disease. Okay, why? Because it increases the sympathetic, so causes bronchodilation. Remember, what are the other agents which cause bronchodilation? What is the other agent causing bronchodilation? Remember. Question for you. Which other agent cause this? Tell me. Yes, it is halothane. So halothane also cause bronchodilation. Very good. Kya baat hai? I'm very happy. You all are doing well. Okay. Now come etomidate. Etomidate. It is an opioid. Etomidate. It is an opioid. And it's cardiostable. So in cardiac surgery, like angioplasty, aneurysm clipping, like in subarachnoid hemorrhage, SAH, okay, or angiography also, we use etomidate. Okay, again, painful on the site of injection, can cause muscle tremor, nausea, vomiting, which is not in propofol, and increased risk of seizure. So that's why neuro mein don't use etomidate. Neuro we can use what? So neuro what we can use? Ketamine is not used. It is also not used. What we use? Mainly propofol or the agents, gaseous agents. Okay. So let's do our revision and tell me. Okay. What is the agent for cardiac surgeries? बता दो भाई. Cardiac surgery. Word पूछूंगा एक बोलना. Cardiac surgery. Cardiac surgery. कोई दिक्कत नहीं भाई. Okay. You can study. Yes. Etomidate. Okay. What is daycare best agent? Daycare best agent. Daycare. Very good. I'm proud of you all. Daycare. बोल दो. Daycare surgery. So daycare surgery. What is the agent? Daycare. Yes, it is our propofol. Then, what is the agent which is causing dissociative? Very good. सबसे पहले NEET MDS mission. Very good. Ketamine is for dissociative. Very good. Then what increase sympathetic? Sympathetic. Ketamine again. What are the fastest induction agent? Fastest induction पूछा है. Induction. Thiopenton. Very good. Thiopenton. What is this cylinder is? What is this gas cylinder? Anyone? What is this gas cylinder? What is this gas cylinder? Yes, it is oxygen. Very good. Okay. Pin index. 2, 5. Very good. Okay, chalo. Now let's wrap up the remaining part. We are almost done. I think another half an hour we'll be done with this file. Okay, chalo. Now we'll discuss malignant hyperthermia. It is a genetic disease, autosomal dominant, which is triggered by our agent. So the mnemonic is Florence sucks ligno, not lingo, so it's ligno. So what is the mnemonic? Florence sucks. Okay, आएगा सब आएगा प्रकाश. चलो. So Florence sucks ligno. Now remember, they are all inhaled agents like ether, halothane, fluorine, except N2O and xenon, except xenon and N2. They are safe. Okay. So all the ether, halothane, fluorine, all these cause the hyperthermia. Then depolarizing muscle relaxant is not known. It is depolarizing. Okay. So just correct it. So sometimes errors will occur because we are humans. We type, so sometimes errors will occur. So I just keep removing. So depolarizing muscle. So depolarizing muscle relaxant like succinyl, choline and lignocaine. So remember mnemonic क्या है? Fluorine suck ligno. Easy. Now pathophysio. In the patient who was having malignant hyperthermia, there is a gene for ryanodine receptor located on chromosome number 19. So which chromosome? Chromosome number 19. There is a sudden excess release of calcium from the sarcoplasmic reticulum, which cause sustained strong contraction. That's why patients start shivering on OT table like this. समझ लो हो गया इसका hyperthermia. Then temperature increase. So that's why we monitor the temperature. It can go very high, even 39, 40 degrees Celsius. Plus there is high endotracheal carbon dioxide. Why? Because this patient is making lots of CO2. So it increase more than 80 to 120. So it is endotracheal tube. So if there is a increase in endotracheal tube, what? Carbon dioxide more than 80 to 120, suspect what? Malignant hyperthermia. And what is the cause of death? As this contraction occur, there is due to increased potassium. So high potassium release from the damaged tissue, which cause arrhythmia and death. And late causes kidney failure, because as the muscle break down, myoglobin is released from the muscle. So myoglobin urea. So there is myoglobin urea. Okay. What is the drug of treatment? Dantrolene is the drug of choice, and also stop the agent. So also stop the agent. So we should stop the agent. And next is we should also do, yes, the maintain ABC, that is ABC, airway, breathing, circulation. Okay, ABC. Now what are the dose? It is 2.5 milligram per kg IV every 5 minutes till the episodes are terminated. Upper limit is 10 mg per kg. That is up to, yes, 10 we can give. Dantrolene. Physio after this. Okay. Now neuromuscular blocking drug. They relax the muscle and that help in intubation. Okay. So relax the muscle. Okay. And help in intubation. Then endoscopy, etc. So all this procedure muscle should be relaxed. Okay. Now there are two types, depolarizing and non-depolarizing. Just remember, depolarizing mimic the ACH. So what they do? They will briefly contract. So they depolarize, open sodium channel, and that's why muscle briefly contract. That's why they cause a contraction and then relax. Like example, how do you make a child stop? There is a child who's crying. How do you make him stop? So number one, okay, don't let him cry. That is non-depolarizing. They don't let the ACH bind. So interfere. Don't let ACH bind. So that is why no depolarization, no contraction. Very simple. So you don't let the child cry. Like he say, I want iPhone, you give iPhone. I want PlayStation, give PlayStation. The child will not cry. Other Indian style, the child is trying to say, I want iPhone. What the mother say? Le, ye lega iPhone. So he cry, ro, cry. Jitna cry karna hai cry, and then he stop crying. So that's why what is muscle contract and then relax called as? It is depolarizing muscle relaxation. So it is depolarizing. Okay. See, arrhythmia, we have to check the potassium level. Main is the potassium level, but when you give dantrolene, it will stop the contraction. Then we control the potassium. We can give calcium gluconate to stabilize the patient. Okay, that will discuss in medicine. Okay, fine, Shashank. Yeah, PDF I'll upload. Don't worry. Okay. Then, so remember, what is contract then relax? Depolarizing. What is no contraction? It is non. So non में क्या होता है? No contraction. So non में no contraction. D में contract then relax. Contract then. Obviously, if muscle is contracting, there is muscle pain and also malignant hyperthermia risk. Also malignant hyperthermia. And train of 4 is absent. Train of 4 is absent minus, it is absent. So train of 4 is absent. Okay. So what is train of 4? That when you give a stimulus, the contractions are going to be blocked. So if train of 4 present, the height will decrease like this. This is called as train of 4. So that is the contraction become weaker and weaker because the ACH is not able to bind. So contractions are becoming weaker. Let me show you. This is our diagram for train of 4. Let me show you. This is our train of 4. Have a look. Okay, so this is our train of 4. Can you see that? So this is normal response. Okay, now if it start to fall, decrease, this is called as train of 4. It is a non-depolarizing. If all are equally short, it is loss of train of 4. So train of 4 is seen in which condition? It is seen in non-depolarizing, absent in depolarizing. They are short acting, few minutes. In fact, fastest acting is succinylcholine. So succinylcholine is the shortest acting. SCH. Okay, and there is no antidote here. Since they can be short and long, there is antidote, so we can control the action. So it is neostigmine, pyridostigmine. What they are? They are choline esterase inhibitor, increase the ACH. So what they do? Increase ACH. So that's why they are the antidote. So they are the anti. I'll do that. I will do that. Electrolyte balance in medicine. Don't worry. Okay. Chalo. Now non-depolarizing are two category. One is, remember, there are two category. One is they are curiums. They are curiums. Curium means queen. ऐसे याद कर लो. Curium is queen. Queen. Curiums are queen. Clear? Curiums are queen. Okay. एंड क्वीन को क्या होती है? एलर्जी होती है. क्वीन को साला सबसे एलर्जी होती है. इसको क्या है? एलर्जी. हिस्टामिन रिलीज. तो क्वीन को क्या है? एलर्जी है. हिस्टामिन रिलीज. सो इट कॉजेस histamine release. Okay, so what cause the histamine release? It's queen, and they are curium. So all curiums are causing histamine release. So curiums cause, queen को allergy है, cause histamine release. Whereas aminosteroids, they are curoniums, oniums. So if the name contain onium, curonium, so curonium are aminosteroids. So they don't have this. Okay, so they are aminosteroids. So aminosteroids is curonium. इनमें क्या होता है? नो हिस्टामिन, नो एनाफाइलेक्टिक शॉक. नो हिस्टामिन. इसमें क्या है? एनाफाइलेक्टिक शॉक का रिस्क है. एनाफाइलेक्टिक शॉक. ओके, बट व्हाट इज द प्रॉब्लम? प्रॉब्लम इज नॉट यूज्ड इन रीनल और liver diseases. So renal, liver disease, don't use them because they are metabolized, whereas they are safe in liver and kidney disease. Safe in liver, kidney. So बस इसी में क्वेश्चन सॉल्व होगा. फिर से कर लो, आ जाओ. ओके, व्हाट इज क्यूरियम्स आर? क्यूरियम्स आर क्वींस. दे आर क्वींस. Coroniums are amino, oniums. So oniums are amino. They are not causing histamine release. They are safe in anaphylactic shock, but they are not used in liver and kidney. Clear? Whereas what is the problem with the queens, the curiums? They are causing histamine that cause anaphylactic shock, but can be used in this. Okay, what are the main agents? It's atracurium and cis-atracurium. Atracurium, cis. Why they are safe? Because they break itself. So they show Hoffman degradation. So they are broken by itself automatically, called as Hoffman degradation. Hoffman. That's why they don't need liver. Do not need liver. So do they need liver? No, they need liver. That's why they're risky. And the fastest is rapacurium, that is not used. So rocuronium is the fastest. And pancuronium is the longest. So I can teach you without the slides also. I know the subject very well, but I'm using it to increase the speed and the type. Otherwise, normal class, I write and teach. Okay. Now, mevacurium is by pseudocholinesterase and it is the shortest acting non-depolarizing. So remember, fastest acting non-depolarizing for use is mevacurium. Out of these, it is the fastest is rocuronium. Out of aminosteroid, fastest. But overall is mevacurium. Again, release histamine, so allergy. Atracurium. Atracurium again show Hoffman degradation or elimination, so don't need liver. But the problem is it causes release of laudanosine. So atra khatra lauda. Atra khatra lauda. Atra khatra laudanosine. And laudanosine क्या करता है? Scissor. दिमाग की दही. So brain को scissor करेगा. तो क्या कहते हैं ना वो? लसन. तो ब्रेन का लीजन करा देगा लसन. So laudanosine, sin sound like लसन. So that's why what are the drug causing brain का scissor? That is laudanosine. Now remember sister, ऐसे याद कर लो sister. So sister में खतरा कम होगा. So sister में no histamine and no laudanosine. तो sister में laudanosine नहीं होता. So remember who has laudanosine? Laudanosine is atracurium, not in cis-atracurium. So who's safe? It is a safe drug. Why? because sister has safer action. If the brother of the girl beat you, not the sister. Like there's a girl and whose brother catch you talking to the sister, he will beat you. But vice versa, if sister see you talking to girl, sister will not beat you. समझ में आ गया? तो sister safe है, sister safe है. Pancuronium is the yes, it is the yes longest acting. कितना याद कर लो? Longest acting. So it is one of the longest acting one. Okay, pancuronium. So it is longest acting. Okay, pan longest. Okay. Now what is the most cardiostable? If they say cardiostable, this is vacuronium. That's it. It is cardio. But again, who remove? Kidney and liver. So I told you curoniums are removed by kidney and liver. That's why they cannot be used in liver kidney disease. And rocuronium is rapid, so it is used for rapid sequence intubation where SCH is not used. That is used. Very long acting, but most long acting is pancuronium. Okay, so it is the agent of choice for daycare anesthesia. We use a combo called as rocuronium and sugamadex. So the question asked, daycare anesthesia, what is the agent muscle relaxant? We use rocuronium plus sugamadex. Okay, चलो. बताया तो है डिफरेंस बिटवीन सिस और एट्रा में मेन डिफरेंस क्या है? इट इज अ स्टीरियो आइसोमर ऑफ एट्राक्यूरियम विच इज मोर पोटेंट, लेस डेंजरस. सो इट इज सेफ एंड पावरफुल. बस इतना याद कर लो भाई. डन है? लेट मी आस्क यू क्वेश्चंस. सो कैन यू टेल मी where will you see train of 4? Train of 4 is present in depolarizing, non-depolarizing. Depolarizing, non-depolarizing. Tell me, train of 4. Depolarizing, non-depolarizing. Train of 4. Train of 4. बोलो. Non-depolarizing. Very good. Okay. And absent in depolarizing. Who is the depolarizing? Succinylcholine, SCH. What is the side effect? It causes the malignant hyperthermia. Very good. Done. Now what are the two non-depolarizing? बता दो. Curiums, curoniums and curonium. Now curiums are which one? They are queens, so they are quinolones, and curoniums are aminosteroids. Amino. What is the risk? रानी को एलर्जी है, so queen has histamine, and it's atra and khatra. Atra and cis atra. Very easy mnemonic. Atra and cis atra. इसमें क्या आएगा? Roku and pen. Roku and pen. Roku is the most commonly used. Pen is the longest. Roku is the most commonly used for daycare anesthesia. Atra and cis atra. What is the use? Hoffman. Elimination. And they are safe. What is the side effect? Loda. No sin. So tell me, is finally for the first time muscle relaxants understood by you? Got a good summary? What is the difference between the two? What is the finding how to solve the question? Tell me, have you finally understood this? Remember? So remember this particular. क्या बात है? Okay, Dr. H. Okay. I was there, I think, last month in the Mumbai for class. So have you understood this? Chalo. Now we'll do the photo part. We'll see the photos and do. It'll just take another 20 minutes and we'll be done. Let's start. So now we are discussing. Leave this. Tuberocurare, no one use, is the first this. Tuberocurare. I fear again. Remove this. Tuberocurare and doxacurium is the longest acting. So the longest acting is doxacurium, but not used much. Okay. Now we discuss the ASA. What is ASA? American Society of Anesthesiologists grading. So it's ASA grading. ASA grading. So it's what grading? ASA. So remember, first is first class. First is first class, healthy without disease. So A1 is healthy. 2 is mild, थोड़ी सी problem, slight. So it is slight disease, but it's in control. Like example, patient is having, let's say, stable angina. Example, stable angina or hypertension. He is in class 2. Then a person is 3, is moderate disease with like COPD, severe COPD, or maybe some diabetes severe. Then 4 is severe disease. So remember, 1 is normal, 2 is mild, 3 is moderate, 4 is severe. Threat. 5 is moribund, matlab can't survive more than 24 hours. Okay, that is 24 hours survival. And this is 6. When you hit a 6, the ball is out of boundary. 6 is dead person, it is dead. And if they say emergency, E is emergency care. E. Let me ask you a question. Tell me, what will be grade for severe patient? Severe disease. Tell me the grade. Severe, severe. What is the grade for severe? Tell me. Grade for severe. Grade, grade, grade. Grade, grade, grade. For severe. Yeah, it's more than sufficient. Yeah, just attend and do. It is more than sufficient for all this. Yes, 4. Very good. What is moribund? So what is moribund? Moribund patient. So moribund patient is what? Moribund. So it is dead. Dead, dead. 6. So dead is 6. Normal, like me. A1. I am A1. I am A1. So I am A1. So I am A1. So what is A1? I am A1. Very, very good. Yes. Done. Chalo. Now we'll see. Next is, yes, there is something called as the Cormack-Lehane laryngeal grades. I don't think they will ask you. It is just to check whether it's easy or difficult to intubate. So that is for intubation. Now, for intubation, we hold the laryngoscope in the left hand. This is the laryngoscope. Okay. And this is the endotracheal tube. So this is the endotracheal tube, ET. So we insert the ET with the right hand, and left we hold the laryngoscope. Now, what is the maneuver and the position? It is also called as the barking dog position. What is the name? Barking dog or sniffing position. Sniffing, barking dog position. So how to remember this? Very simple. Okay, it is CL, like NLC and NLC. So we NLC, chin is lift, head is tilt. Chin is lift, head is tilt. So remember CL H, head and tail. तो याद कर लो, C के साथ L जाता है ना, कॉलेज या फिर NLC या कुछ भी याद कर लो. And HT, hit is what? हेड एंड टेल. तो याद कर लो, हेड को टेल करेंगे, हेड और टेल. निमोनिक याद कर लो, हेड एंड टेल. सो हेड को टेल करोगे और चिन ऐसे उठा लो अपना सर, रेज योर चिन. सो चिन इज लिफ्ट, चिन इज लिफ्ट, चिन इज लिफ्ट. ओके. देन अटलांटो ऑसिपिटल जॉइंट, it is basically reduced. So we will do reduction, that is we will do extension of atlanto-occipital joint. So it is extended. So what do you extend? The head is extended, okay, and the neck is flexed. The cervical spine is flexed. Okay, just leave it. Okay. Now airway evaluation is basically, mnemonic is obese. Obese person difficult to intubate. Their airway are not easily accessible. B is beard. Again, beard is causing difficulty putting the mask, etc. Then edentulous individual, no teeth. If no teeth, it causes gum recession, again difficult. History of snoring, that is they have a obstructive sleep apnea, again difficult. Or elderly, with age everything is difficult. So elderly patient. Okay. Now airway evaluation, that is mallam patti. We check how much mouth can be open. So I'll make it easy for you. In class 1, the pillars are seen. In class 1, what is seen? Pillars. These pillars are visible. Can you see the pillars? So pillars are visible. So if pillars are seen, it is class 1. Here pillar is absent. So the pillars are hidden, that is 2. So pillar. In this, even the what is gone. Here what happens is our soft palate is seen, but yes, soft palate. Okay, the base. So tip of uvula is gone. Tip of uvula is gone. And here that is soft palate is seen. Only soft. And here only hard palate. Here even soft is gone. So let me revise for you. Okay. So what is the case? If pillar is seen, it is 1. If pillar not seen but uvula seen, it is 2. If uvula tip is gone but base can be seen, that is called as your 3. And if soft palate is also gone, only hard palate is seen, this is HP, hard palate. So only hard palate is 4. And remember 3 and 4. So large tongue and grade 3 and 4 is difficult intubation. Very, very, very important question. It is difficult intubation. Okay. Then, or the mnemonic for difficult laryngoscopy intubation? Again, look externally. If any trauma, big teeth or beard, large tongue, they are difficult. I told you already. Then high arch palate, so it become narrow angle, again difficult. Then evaluate 3-3-2 rule. That is Mallam Patti more than 3. I told you grade 3. Or obstruction, any abscess or inflammation or neck mobility is reduced. Again fracture, so that is called as lemon. So lemon check karo, lemon देखो पहले lemon, okay. Pillar बच्चा ये pillar है, okay. Understand, it's pillar. This area you see, these are called as fascial pillars. These pillars should be visible. Here they are not visible. So that's why pillars and even the tonsils are visible. So these are tonsils, these are pillars. अब समझ में आ रहा है? T and P. If they are visible, it is class 1. It is class 1. Understood? Done, done. Thank you, Dr. Priya. See, if there is a problem, might be difficult, they might even do tracheostomy. Understood? So if this is difficult, they might have to do a tracheostomy, which could be emergency or planned depending on the situation. Okay, chalo. Now comes the question, the Boyle's apparatus. So what we are discussing, this is called as the Boyle's apparatus. Boyle's apparatus. Okay, so Boyle's apparatus. Now first question, these are the vaporizer where you put the fluorines. Remember, fluorine canister. So you put the fluorine canister here. Then there is a system switch which help you control the supply, etc. This is flow meter which tell you the flow rate of the air delivered per minute, that is the supply of the air or oxygen. Then it show the flow meter value, oxygen value which is delivered. Then this is the assembly line which show the movement. Then here come the rebreathing bag which you can use to give the air to the patient. Main is, this is soda line which is carbon dioxide absorption, soda line. Soda lime is basically calcium and sodium hydroxide. So it is sodium calcium hydroxide. Sodium and calcium. 3, Mallam Patti 3, Mallam Patti 3. Then number 3 is our, yes, obstruction. Okay, that is number 3 score. And 2 is neck mobility. It's called a 3-3-2 rule. 3-3-2 rule. Okay, so sodium and calcium hydroxide, and it is absorbing the carbon dioxide. It absorbs carbon dioxide. Why? Because a person who's in a circuit, whatever CO2 is made, it can cause CO2 toxicity, hypercapnia. So this soda lime remove the carbon dioxide. So absorb and remove CO2. Okay, and what is the color? Fresh is pink. तो याद करना गुलाबी है, fresh गुलाबी होती है. Fresh is pink, fresh pink, and later it become white. White means it is used. White is used. White is used. Okay. Now these are cylinders. These are the cylinder which you can connect depending on the use, oxygen, nitrous oxide, or cyclopropane. These are the cylinders. Okay. Now this is the anesthesia monitor. This is monitoring oxygen level, heart rate. Why? Arrhythmia risk is there. Then we measure the carbon dioxide, that is capnography, which I'll discuss soon. Now pulse oximeter, check the saturation, and everyone know it post COVID. So it is saturation. So if hypoxia is there, you check with oximeter. Arrhythmia, ECG, arrhythmia, ECG. And also we take the BP, so that if shock is there, we can check the shock. This is the Goodell's airway, basically used to prevent the obstruction of the airway. So we can put the Goodell airway so that the airway is kept open, because tongue can fall. Basically tongue fall down and cause the airway obstruction. We use the Goodell's airway. Goodell's airway. Laryngoscope is basically having a light source, a curved blade. This is the blade, and this is the handle. It is used to hold and visualize the larynx and do the intubation and do the intubation and do the intubation. Yeah. Chalo. Next, Macintosh are basically the curved blades which we are using. Smallest is obviously children. Miller is, yes, the blade is used in children because children have much straighter and the wider one. So that's why I use the Millers in children. Oxford is obviously infants, is very small one. Then flexible laryngoscope or bronchoscope, they are the gold standard for difficult or failed intubation. They are very thin pipe which with light source and camera, they can be used to, yes, check the, yes, larynx. So there are different types, leave it. Now endotracheal tube. So it is used for artificial airway. So they are artificial airway used for connecting the patient with the system. Artificial airways. And remember, endotracheal is a secure airway. It's a secure airway. Why? Due to cuff, it prevent aspiration and remain in its position, doesn't move, prevent aspiration. Otherwise, a patient can aspirate his own secretion, causing the lung problem like aspiration, pneumonia, etc. So it's a secure airway. Due to cuff, it prevent the aspiration and remain. This is the cuff. This is the cuff. It is an extra opening called as Murphy eye. So Murphy eye is the extra opening which is present in this case. So Murphy eye, okay. Murphy's eye, okay. Yes. This ear-like structure, it look like ear. If they ever give a ear-like structure, it is a laryngeal mask airway. What is LMA? Laryngeal mask airway. Laryngeal mask, okay. It is not a secure airway. So it is not secure, the high risk. So that's why it is not secure. So that's why what the best endotracheal is best. What the best is, this is endotracheal, okay. This is laryngeal mask, okay. Laryngeal mask. It look like a ear. It look like a ear. Thank you, Dr. Sharian Khan. Okay, chalo. Now let's start. This is again laryngeal mask. Double lumen. So remember, double lumen is basically used for lung surgery. Let's say you want to do surgery on one lung. If you do a normal endotracheal tube, air will go to both the lung. How will you do the surgery? So to separate the two lungs, so it is basically to separate the lungs from each other. One lung we give the oxygen and the anesthetic gases. Other lung is now available for surgery. So it is done for lung surgery or even chest surgery, okay, or pneumotomy, that is removal of lung. And it provides single lung, that is out of two lung the gas is going to one. So if you ever get a cuff with two openings, it is our double lumen endotracheal tube. So double, also called as commie tube, This is the cuff one which is best for prevention of aspiration. The pressure is, remember, 20 to 25 H2O. MCQ. So the pressure in the cuffed endotracheal tube, it is 20 to 25 centimeter H2O. 20 to 25 centimeter H2O. Okay. Yeah. I will post it later. Bhai, abhi to bana hi raha hu main yaar. Okay. I'm just making it. Once it's done, I'll post. Okay. Now these are intubating laryngeal mask. Okay. So again, I'll skip. This is ProSeal. Okay. This is ProSeal. It is also having a gastric drainage tube. That is the main benefit. It is allowing a extra outlet or extra phenomena that is particular in this case. Okay, so what is here? Extra outlet or the phenomena is taking place. Okay, fine. So extra outlet is there. Extra outlet. Okay, done. So remember, it is for gastric drainage. So what is the tube with gastric drainage? Like aspirations can be removed. That is ProSeal. So ProSeal is gastric. ProSeal, just body yaad kar lo, gastric. Superior you can leave. These leave. Eye gel. Yes, we are just keeping them. Okay. Now monitoring. How do you do monitoring? ECG is for arrhythmia or cardiac arrest. BP for shock, hypertension. Pulse oximetry for obviously SpO2, hypoxia. Temperature. Temperature is used for which purpose? Temperature is used for malignant hyperthermia. Okay. Okay. Just remember, if they're asking in water, it is 20. If you decrease it by almost what? It'll become 10 to 15 mmHg. I don't think they will ask you. Okay. My personal opinion, they will not ask you pressures of cuff in mmHg. 20-25 याद कर लो, बहुत है भाई. इतना डीप में जाने का कोई फायदा नहीं है. Even we teachers don't know. Okay, even I don't know. I've never seen a question on this in anesthesia. चलो. Now capnography is basically recording carbon dioxide level in endotracheal tube. What is the normal? This, and it give a graph square box. So it gives square boxes. square box. Now remember, help in endotracheal tube insertion, placement. So how do you know endotracheal tube is placed perfectly? We check the carbon dioxide. Where's the CO2 coming from? Lung. So if the tube is not placed perfectly, CO2 will not enter. So that's why by checking the CO2 level, we are able to know whether the tube is in right place or not placed. So that is why, how do you know the trach placement? That is the case. Now example, if the tube gets out, you'll get a flat line. Okay. So example, extubation. That is tube gets out. We get a flat line. So if extubation, flat line. Now remember, what causes increase EtCO2? Increase E2CO2 is seen in hypoventilation. So if a person doesn't breathe, carbon dioxide will increase, or increase metabolism, fever, or very, very important, malignant hyperthermia. Malignant hyperthermia. Here it can be 80 to 120. 80 to 120. And decrease carbon dioxide is reverse. Okay. And what is shark fin pattern? Shark fin. So shark fin in COPD or obstructive disease. Okay, shark fin. Yes. Yeah. See, bilevel is the cut section which is used to insert into the airway, and it has an extra opening near the bilevel. That is called as what? Called as a Murphy's eye. Okay. यारो medicine में कराऊंगा शुभांगी. I'll do in medicine very well. Don't worry. Medicine is pending. If I explain arrhythmias now, our anesthesia will not be finished. I'm going subject by subject. Don't worry. Okay. Chalo. So this is normal capnography. Can you see? So it look like boxes. So it's normal capnography. Values 35 to 45. Spasm, you get shark fin. So you get the shark fin. Shark fin. So this shark fin. Then if CO2 is increased, it is hypoventilation. Treatment is increase the flow rate. So what is the management? They ask you sometime, increase the flow rate. So give more air to the patient. So management is increase the flow rate. Can you see? It is increase height. If decrease, it is hyperventilation. So patient is breathing more, decrease the rate. So it is decrease, and also can be metabolic acidosis or fall in body temperature. Okay. Then rebreathing is faulty expiratory valve. The value keep on rising. That is called as rebreathing. Curare cleft. When you give curare, it causes a stopping of respiration. So it causes a cleft. So if you see a cleft, it is curare cleft. Curare cleft. If there is a arrest, you will get a flat line. So that's a flat line is there. That is called as cardiac arrest. Okay. And once the respiration start, it will again come back. So that is called as spontaneous. So let me revise. Tell me, what do you see? This is normal. This is normal. Tell me, what is this? What is this one? First one. Can anyone tell me what is this? Can anyone tell me what is the diagnosis? Thank you, Shafiq bhai. For the diagnosis, diagnose shark fin. Diagnosis COPD, obstructive disease. Okay. What is this one? Very high, 80. Very high, 80. Chalo. It is malignant hyperthermia. Very good. What is this diagram show? What is this? What is this? Batao bhai? Yes, this is curare cleft. Very good, very good. Chalo, last 5 minutes, then we are done. Okay. Sorry for increasing speed, but main baat karenge na kaam ki. Chalo. Circuits. Now there are 3 kind of circuit. Open circuit. In open circuit, we just add the agent. It's like a Indian system. Remember Indian film? Indian film. How do they give chloroform? Chloroform. They will put chloroform on the paper and put in the mouth, and the person become unconscious. So the problem, the gases can escape and cause pollution. So that's why even the doctor can become unconscious. So it is the easiest method पुट क्लोरोफॉर्म, ईथर, हेलोथेन, बेहोश हो गया बंदा. But problem, even the doctor can become unconscious. So that is why it is not a very good method. So doctor can also become unconscious. So that's why it is not used. Okay, only used in Indian film. And remember, Indian film show crap. Like in Indian film, they show during this person, it take minutes for chloroform to act. Number two, in Indian film, they show if a snake bite you, you should suck the poison. Never ever suck the poison. Number one. Can you suck poison from the body like this? Are you a vacuum cleaner? No na. Number two, are you very experienced in sucking? मतलब ऐसा क्या suck करते हो कि तुम्हें पता है कहाँ से कितना करना, experience हो क्या? नहीं ना. Number three, if you die, and can you suck from any body part? Can you suck from gluteal? किसी के पिछवाड़े पे सांप ने काट लिया, वहां भी suck करोगे क्या? So that's why don't watch Indian movie for medical education. Don't watch. Okay. चल. Closed circuit. Closed circuit is non-breathing. That means the gases are in the circuit. So that's why it doesn't release the exhaled gases. They recycle. That means the patient is not losing the anesthetic in the room. So that's why doctor is safe. So that's why it's no pollution. No pollution by the agent. And problem is what? Only problem, CO2. So CO2 is there. So we need to put a CO2 absorber. Which one is fresh? Tell me. Which one look fresh? Which one look fresh? Yeah, बिल्कुल बिल्कुल. Yeah, बिल्कुल ऐसे पल्स देखता है and say she is pregnant. Indian film doctor from pulse say it's pregnant. Now tell she is having twins. Also tell she is having placenta previa. मतलब कुछ भी सिर्फ पल्स से. हाँ चलो. Okay. So pink is fresh. तो याद करना जितना ज्यादा गुलाबी उतना fresh. So remember pink is fresh. So I think all of you know गुलाबी मतलब fresh. Pink is fresh, pink is fresh, pink is fresh. ठीक है. तो जब भी लेना सोडा लाइन देख के लेना, गुलाबी हो तो लेना, गुलाबी ना हो मत लेना. So it should be pink, fresh pink. Okay. Now this is the circuit. This is the reservoir bag which contain extra air for circulation. The ventilator machine which push the air. This is the CO2 absorber soda lime. This is a fresh gas inlet. And here we are breathing. This is the patient connected. It goes to patient, and that is how the breathing is occurring. This is how the breathing is occurring. Okay. Now, third is semi-closed. It has benefits of both. तो याद करना, what is having दोनों के मजे? Both. It is semi-closed maple sun. It is semi-closed. So that means it will have the soda lime, but also have provision for fresh gas coming from outside. So that's why it is called as what? It is called as semi-closed. So what is the problem with open? Pollution. Close need lots of soda lime and the connection and maintaining the removal of the gases, but semi-closed is best. So it is the best, most used and best. Okay. Now it is categorized into 6 categories based on the fresh gas inlet. Now let me teach in my style. Remember, A, B, C, D. A, B, C, D, E, F. Now BC नहीं करना चाहिए. Not used. Not used. EF is infant, children, pediatrics. EF is children. So remember A, B. So adult is A and D. So what is adult? A and D is adult. AD adult. So what is used in adults? A and D. Adult is A and D. Children, EF. Children, EF. Okay. Now A. A for alone. That means patient can do his own breathing, spontaneous ventilation. So that means patient is having spontaneous ventilation. Whereas D is dependent. D for dependent, yaad kar lo. Dependent. That is controlled breathing. Controlled ventilation. So we have to control his ventilation. And now spontaneous. When you are alone, what you make? Alone, Maggie. Maggie. So remember, Maggie. So when you are alone, what do you make? Maggie. So alone बंदा मैगी बना के खाता है. But if he is having the D मतलब इसका कोई D dependent है तो क्या होगा? बिरयानी खाएगा. बिरयानी. So Bain circuit. So dependent is Bain. Dependent is Bain. So remember, if you have a Bain or BV, she'll make biryani. So remember, अकेला बंदा मैगी खाएगा. Alone Maggie. or dependent biryani. So biryani, you need someone to cook it. Maggi, you can cook it alone. So alone is Maggi. Alone is Maggi. Didi banaigi biryani. Didi. Dependent is biryani. Dependent is biryani. Is it clear? Okay, Shashank, later. Okay, chalo. Fine. So now let's start. And remember, the fresh gas is close to reservoir in cases of your ENF. Okay, it's very, very important. Chalo. So Mappel son A is Magil for adult spontaneous. D is main. फिर से आ गया निमोनिक. Magil, Maggie कौन बनाएगा? Adult में spontaneous. और Ben is controlled. Ben is controlled ventilation. Control. Okay. And what is Jackson Rees and IRTPs? It is for pediatrics. So in children, both spontaneous and controlled, we use Jackson Rees and IRTPs. IRTPs. Last, resuscitation. Again, I will not discuss much because they are covered in medicine also. So ambu bag is artificial manual breathing unit. It contains the face mask. Then it has a valve, a bag which you pressurize to push the air. It fill itself. So it's a self-inflating bag. Then we can connect it to the oxygen supply also. This is called as your ambu bag. It is called as an ambu bag. Okay, chalo. Then this Venturi mask, okay, again it is to increase the oxygen supply through the nasal cannula or Venturi mask. This is to increase the oxygen saturation, Venturi. So that's why patient with hypoxia, we can give Venturi. If the patient has difficulty breathing, less breathing, we can give ambu bag. This is the patient who can breathe. It's supplemental. Clear? And if the patient has poor respiratory, like very less, then we have to give the ambu bag or ventilator. Okay, chalo. Now low flow system or high flow system. Low flow systems are like nasal prongs. They are put in the nose. High flow are basically the air and mask or heated humidified through nasal prongs. So remember, nasal prongs are high flow. Reservoir are like the ones with the ambu bag. Okay, this is the question they ask. What is the rate given? So cannula, one nose. So one nose is one. Face has 5 opening. Eyes, nose. So face is 5. Face is 5. Nose, only one nose, 1. Okay. If partial breathing mass, 6. Flow rate is 6. Okay. Non-breathing, it is 10. So 10 means he's not breathing. We are giving it from outside. And Venturi, V is 2. V. So V is 2. So remember, let me ask you, tell me, what is the rate of nasal cannula? Nasal. Tell me, thank you. Dr. Rohit, Dr. Lasha, tell me. Yes. 1. Face. 5. Face is 5. Okay. Non-breathing rate. Pranam by Pranam. Non-breathing. 2. 10. And Venturi. 2. Even I never remember them correctly in my life. I'll keep forgetting. But today we have done it. So I'm very proud of you guys. All these 300 people who are there in the class till the end, they are going to rock. And I'm telling you, each one of you is going to get a great rank, great score, pass the FMG, get NEET PG seat, and come to me with sweets. So are you coming to me with sweets? Yes. This is called as percentage. It is FiO2. It is called as FiO2. That is percentage of oxygen. It is point, that is 24 to 44%. I'm just telling you, okay. Time is less, so I'm doing it like this, okay. So last topic and last is the diagrams. This is nasal cannula. Can you see these 2 openings? ये नाक में ऐसे घुस जाती हैं. So this is nasal cannula. 2 openings. So 2 opening nasal. This is normal face mask used in COVID time. It is what? 5. Okay. Then this is face tent. It cover the face. Very good seal. So it give 10 to 15 liters. So it doesn't leak out. This is Venturi mask. This is the Venturi mask. It has a valve. So it contain a valve. So the valve one is Venturi. Valve Venturi. Valve is Venturi. This is non-breathing. This is non-breathing. There is a reservoir attached. So you can see this attached. This is non-breathing ones. Okay, non-breathing, sorry. And this is the high flow nasal cannula. It is, can you see, thicker and larger? This is smaller. This is a high flow cannula. Again, this again nasal cannula, again this face mask, again same thing is repeated. Okay. Finally, regional anesthesia. So remember, spinal is quincke. You asked me the question, I said I'll discuss now. So spinal is quincke. Spinal is quincus, spinal, and epidural is tuhi. Epidural is tuhi. So tuhi, it's okay. Tuhi. Epidural is tuhi. Epidural is tuhi. Okay. And color, I told you, halothane is red, blue is des, yellow is sivo, purple is iso. Purple is iso. Purple is iso. That is the color. And drugs which need to be stopped, MAO inhibitors. Which one? MAO. They are Jalins. Salajalin. Salajalil. So Rasajalin. Salajalin. So Jalil are stopped 3 weeks before. Oral coagulants 4 day. Warfarin is oral 4 day. Heparin 12 hour. Heparin 12. Remember, heparin 12. Oral 4 day. Oral. Antiplatelet 7 day. Like clopidogrel. Aspirin is not in this category. Then thrombolytics 10 days. Thrombolytic like which one? Any drug we are using for thrombolysis, they should be stopped. Like all the kinase, streptokinase, etc. Then NSAIDs 48 hours. NSAID 48 hours. Okay. Disulfiram 10 days. Herbal 7 1 week. Smoking 8 weeks. So abhi se band kar do. Abhi se. Antihypertensive can be continued, are omitted. Rest are continued till the surgery. If unfractionated, last dose 4 hours prior to surgery, heparin. But if it is given, it's 12 hours. Low molecular weight like enoxaparin, etc. Enoxaparin, it is 12 hours. If it is normal one, it is 4 hours. Anti-TB, same day of the surgery. Oral hypoglycemic agent insulin, it is on the day of surgery as the patient is fasting. Otherwise, hypoglycemia will occur. Warfarin 5 day. Warfarin 5 day. Warfarin 5 day. Okay, warfarin 5 day. And finally, yes, all psychiatric continue till the day of surgery. So with this, we wrap up our session, and I am very, very, very happy and yes, glad to announce that we have again finished one more of our great sessions which are going on. I'm saving it. Chalo, thank you for coming to the class. In 2 hours, again, rather less than 2 hours, I started at 9:10. It is 54. So in 1 hour 45 minutes, I have ensured 3 marks. Challenge. Any exam question, you will be able to solve 90% of question. Even if they are INICT, they are NEET, FMG, all be solved because I trust my content, I trust my team, I trust they are working hard to make a very good content. So that's why I am sure it will be covered without any problem, and I'll be sharing this PDF in a second. You can use it, and that is there. Okay, chalo. After passing, I'll do pharma also. Okay, yeah, I am doing pharma also. Yeah, बिल्कुल भाई देव कॉमरेड आएंगे उज्जैन अपने, ठीक है, महाकाल की नगरी. चलो, thank you very much to all of you for coming. It's all your love and care. That's why we are having such great team working hard, and we are not focusing on useless content. Only crisp content, required content which can be revised, which can be understood even before the exam. Just have a look at this file before the exam. All my written words you will remember. That's my trust that you will remember what I have taught you, and you will be able to solve any question. Okay, clear? Motivation, I told you na, motivation biggest is look at the future. You will get what you want. If you're a FMG exam giving, you will pass the exam, you will bring joy to your parents, you will become a successful working practitioner, you will get PG seat. Those who are need PG, they'll get a dream branch of their choice. You will be earning in crores, buying a BMW, Mercedes, then going abroad. So if you work hard, you will have a honeymoon, okay, in Switzerland, maybe Maldives. If you don't work hard, maybe Goa. If don't work hard, maybe in some village, or maybe in Gautam Nagar. So that's why your hard work will decide your future. Okay, so kya baat hai? Very good. 180, that's very, very good. PDF is there in the Telegram. So I'm telling you, please, please, please go to the YouTube पे आप हमारा चैनल सब्सक्राइब करो. ओके सो क्या कहते हैं, लाइक शेयर एंड सब्सक्राइब, ठीक है, भूल नहीं जाना, लाइक शेयर एंड सब्सक्राइब. एंड व्हेन यू क्लिक द वीडियोस, just write integrated learning, you will see the videos. In this video you can see what you do, just click the video and in the description you will get everything. Like in the description you will see the PDF in the drive, you can click, they will open. Let me show you. So this is the PDF. Psychiatry, anesthesia I will post now, it is just now finished, so you can download, you can open, they will be available for download, you can click, they will be downloaded and you can use them. Then this is our Telegram channel, you click and our Telegram group will be, channel will be open. So open, this is our channel, 6,000 subscriber here, and in our group it was blocked by some nasty people, so 31,000 are in our group. Okay, and this is a NEET PG channel which is having PG content mainly, you can join there. Then you can also give our free mock test. Let me show you our NLC mock. Okay, you can just click, this is our NLC app which will be shown to you. More than 10,000 downloads are there and review is 4.4, and I'll just show you the number of people who are there in our mock test batch. So 7157 are already there giving the NLC mock test, 12 will join more, so you can easily imagine how many people are right now giving NLC mock test. Okay, I will do medicine surgery the best. Okay, so 10th of December, mark your calendar. I'll show you the date of the examination also. So this is our date for examination, I'll just open the announcement. So these are the announcement we make to the student, these are the dates of the mock test. All of you are, tomorrow we are not doing any session, okay, again because our team also need a break. Okay, we are all exhausted from making, so to make the GT also, so give us just one day time, then I'll start with the physiology. We'll finish physio, then do patho pharma. Okay, ortho afterwards. Okay, so the target is physio, patho, pharma are the next subjects, and then we can do the ortho. Okay, yeah, so tomorrow we are, yes, there are so many people who are, you know, after us, I can't even tell you, like I'll tell you. Okay, people are jealous just because you are doing something good, that's kind of people. Then you help someone, let's say the person is very hungry, you give them a piece of roti chapati, initially they'll be very grateful, thank you bhai aapne sir aap. Then after few days they will start saying, why are you giving just chapati, can't you even add one achar, one pickle? You say, okay, I'll add pickle. You say, sorry. Then you give the pickle. Then after few days this person will not be happy, now they say, how will I eat just with pickle, can you give some dal, bhaji, sabzi, some kind of curry? You say, okay, sorry. Then you start giving them the sabji, curry, bhaji. Then they say, there's no salad. Okay, constipation ho gaya mere ko, kabji ho gayi tumhara khana kha kha ke, can you, so now as a good person you give them the salad also. Then they say, no sweets, kuch bhi meetha nahi dete aap. This person, you are doing everything, still he is not happy. One day you give him 5-star thali, you give him his own, all your house, your business, still he'll say, why you're giving me now, why you never give me earlier, why you're not giving me your car cheese. So people are like this also, you help them, you support them, in the end they will stab you in the back, they will find mistake in your work, they will not realize what you do for them. From one single chapati they were asking, you are giving them thali now, luxury deluxe food, job, work. That's what happens in job also. You get an employee, initially is thankful, start abusing you, my owner is bad, he doesn't give me this, he is living in luxury. Why? He worked hard to achieve that success, you are at his mercy. So please be grateful to people who help you and don't bite the hand which feed you. So that is what the summary is, be very yes. So we'll do all the subject. Some subject we have to do in January, we cannot do all in December. December is just 25 days left, not possible. Larger subject take more time, so I will finish by 10th of January. So be with me till 10th of January. Okay. Chalo. So we will finish, take care, bye bye. Yeah, okay, good night, take care, bye bye. It's 11, I am hungry, I will also eat something. and you people also eat something. And I'll try to take classes at 8 o'clock also, so that we get more time. So bigger subject I will try to take at 8 o'clock, but please do share the links. It will not harm you anything. Just a share will increase our motivation. Yes, pharma will also do. Okay, pharma we will also do. Okay, schedule I told you already. We'll do from 7th pharma. So I'll tell the schedule. So 7, 8, 9, 10, 11. Physio, patho, pharma, FMT. So these are planned for you. Then we can do the other subject like ENT, etc. So we'll then decide to do based on the notes availability. Okay, chalo. Open the new Telegram. Open the new Telegram link. So please open the new Telegram link. Sufficient. It is more than sufficient, bhai. Okay, Dr. Nani, it's not sufficient. More than sufficient to solve any question. Okay. Yeah, we will do anatomy also. Don't worry. Okay. Let me finish. Okay, I'm not well. Let me get some medicine. Take care. Bye bye. Good night. Good night to all. Love you all. Love you all. Love you all.